Anthony.
Hi, how are
How's
you?
it going?
Good, real good.
Good, it's good to see you. My name
you.
is Sarah. I will be your therapist today.
Mm-hmm.
Welcome to our medical spa.
Thank you.
So I have down here that your first name is Anthony. Is that okay if I refer to you as that? Okay.
Definitely.
Can I have you confirm your age for me?
31.
31. Very good. And why don't you just tell me a little bit about why you're here today? How can we help you?
Yeah, I like to work out a lot, about 3-4 days a week. Just experiencing some soreness in my, especially my shoulder, and my back a little bit too. So just, trying to see what's going on with that.
Okay, so some soreness specifically in your shoulder. Is it both shoulders?
Mostly my right shoulder. I'm right-handed, so I don't know, maybe if that means anything.
Okay.
And just all on my back.
Okay. So I'll just ask you a couple of follow-up questions. So you work out pretty frequently. Can you tell me what kind of workouts you're doing? Are you lifting weights? Are you doing more aggressive, extensive workouts?
So yeah, mostly lifting weights, calisthenics. I don't power lift, but I do lift a lot of reps, and I think I try not to go too heavy, but I do feel some soreness, like clicking sometimes in my right shoulder, and kind of some little bit of discomfort too. Sleeping, I don't sleep the best either, so.
Having some issues with your sleep too. Okay, so let me just jump to that for a second. So the issues that you're having with your sleep, is that not enough sleep, not enough hours, the quality of sleep is lacking? Is it multiple things?
All the above.
All of the above.
But I also feel like I sleep on my right shoulder too, and I don't think that's good for it either. I sleep on my side.
Got it.
Mm-hmm.
Okay. Can you tell me about how many hours of sleep you're getting on average?
Probably 5.
Ooh, okay, so definitely not an adequate amount of sleep.
Yeah.
And in those 5 hours, would you say it's restful sleep? Are you hitting your second stage of sleep, what we call REM sleep cycle, or do you feel like you're still not quite getting into that deep sleep?
I feel like not quite getting to the deep sleep.
And is it typically kind of difficult for you to fall asleep?
Yes.
Okay, so just jumping back into the soreness or kind of possible injury. So you said you're definitely having some clicking, stiffness.
Yep.
Okay. And so clicking is a very specific sensation. Do you notice any popping?
No popping.
So nothing that would indicate kind of a more serious injury or dislocation, anything like that. Okay. So it's definite soreness. Would you say the soreness is constant, or is it exacerbated by working out?
I think it's definitely when I work out. Maybe a day or two afterwards, I sound crazy, but it almost feels like it's hot almost sometimes. So
that's a good possibility. We will do some temperature checking, so that could be an indication of some kind of increased muscle tension in those areas. So we'll definitely have a look at that today.
Okay.
Are you having any issues with your range of motion or lack of range of motion, lack of flexibility?
No, not more than usual.
Okay.
I'm not the most flexible person, but I can lift both my arms up to what I mean.
So even with the soreness, you're still able to fully extend your extremities. Okay. So looking at possible overuse, but if you're a regular kind of mostly athletic person, then that can be typical. Are you in pain at this moment?
No, I think it's a minor soreness on my right shoulder, but nothing that would impact the quality of my life or to do things. So.
So if you could rate your soreness on a scale, let's say 0 is absolutely no pain, 1 to 2 is a mild aching pain, 10, you said you're not experiencing at this time, that would be the worst pain that you could possibly experience. What would you say it is at this time?
I'd say a 3, 4 max.
So mild to moderate. And on your rest days, are you doing any kind of stretching, yoga, anything that would increase your flexibility, increase your muscle stamina?
I did start doing stretches and yoga recently. I've been working out for years, so I think that's helping. I could definitely do more though.
Okay, but you have started, so that's good. Now, this question might seem unrelated, but it is definitely something that can play into the physical aspect here. Can you tell me about your current stress levels?
I would say moderate to moderately high.
Okay. So you're feeling increased stress kind of on a day-to-day basis, which can lead to excess tension, especially in the shoulder area. We tend to carry a lot of stress in our shoulder and our neck.
Yes.
So that's definitely something that I'll look at today. Okay. All right, Anthony. Well, it looks like we have a good idea of what we need to look at. I have several different tools that we'll be utilizing today. Some of that might change based on my initial assessment. So let me just set this down. So I will go ahead and get my gloves on. If it's all right with you, I'll have you remove your shirt.
Okay.
So I'll give you a second to do that and we'll get you covered back up. I'll do kind of an initial exam and then we'll start with the physical portion, okay?
Yep.
All right, Anthony, are you comfortable?
Yeah.
Okay, so I'm gonna start with a visual assessment. I'm just gonna be looking over your chest and abdominal area, see if there's any kind of outward signs that there might be something going on, okay? So just having a look. And this is the shoulder that you said was kind of affecting you a little bit more. Just having a look at the clavicle area, one side compared to the other, looking for any notable signs of swelling or any areas that might be kind of slightly edematous. Is any of this sore as I palpate around?
Right there, I guess that is my, is that like your delt? Yeah, like right there. A little sore. And underneath, I guess like kind of where your armpit, like where your teres is at, like your teres major, like it's a little sore under there too.
Okay.
Yeah. That's where I feel like sometimes like the warm sensation is sometimes.
Okay, so maybe some inflammation going on there.
I also work like an office job, and I don't have like the best posture, spot like my neck and stuff. So.
Is your chair like an ergonomically designed chair? Is it an office specific chair, or are you just sitting at like a regular chair?
It's supposed to be ergonomic, but I
not
don't know.
Doing a great job. Okay. Any soreness in your pectoral area and your chest here?
No, not really.
Okay. And then as I palpate around on this other side, you don't feel that same discomfort?
No.
Okay. Interesting. So I'm just gonna have a look at the shoulder itself. So luckily there are no obvious signs of edema, which means there's no swelling in the joint. I'm not noticing any asymmetry, which would indicate a dislocation. Everything seems to be aligned properly. So that is a good sign. If it's all right, I'm going to pull this down just a little. Okay. So I'll just have a look at your abdominal area, and because you lift weights, I'm just looking for any signs of excess muscle straining. We obviously want to kind of rule out any indications of a hernia. Which I'm not seeing any abnormal swelling here. Any discomfort with this?
Not at all.
Okay. I'm going to set this down and do a little more of an extensive palpation. So essentially I'm just going to be pushing in a little more firmly. Trying to really gain access to the individual muscles and ligaments here. So if any of this is really excruciatingly painful or even more uncomfortable than you would like to endure, just let me know and I will stop. Just trying to gain a little bit better of an understanding. So comparatively, I'm definitely feeling more tension on the right side. Like you said, you're right-handed, so that is to be expected because you're probably overcompensating with this side.
I was definitely thinking that. Yeah, for sure.
So I can tell that a little bit. You're definitely overcompensating with your right side. And I will go over some recommendations with you. I'm just feeling the outer edge of your rib cage.
Yep.
Again, just checking for any signs of an abdominal hernia, which I'm not noticing, honestly. Can I have you take a big, deep breath in, fill your belly with as much air as you can, and hold it for just a second. And go ahead and blow out. Very good, okay. Perfect. Now you said you feel like you have some soreness, heat, kind of under your axillary area. Is it all right if I have you extend your arm? Okay. So I will have you just kind of reach up for me. Is this position painful for you?
No, it feels fine.
Feels okay. Just having it feel. So you have two primary sets of muscles here, one on the underside and then one that's kind of lateral here. And I'm just feeling for anything that might be out of place or abnormal, any signs of like a more serious muscle strain. I'm not feeling that. So how is it here?
Yeah, it's
this is more where it's
definitely
sore.
the first spot you touched is definitely
Here.
sore right in there, and maybe a little higher up too.
Here.
Yeah, right in there, like a little bit before the armpit.
Okay.
I do work out like I do my lats a lot, and I definitely think that may not help either. I do a lot of shoulder workouts,
Okay.
and yeah, like right up in there, I definitely feel it.
Okay. So I'll have you rest this arm directly over your chest there, so that you're not holding your arm up, but I still have access to the area. I'm just feeling around. Okay, so I do feel a little bit of that hotness that you were talking about. Okay, so I'm gonna have you just relax your arm down for me. Is that comfortable for you?
Perfect.
Okay. So just checking to see where exactly that temperature changes, because I definitely feel
Yeah, it's weird.
kind of residual heat in this area. Stretch a little bit to kind of your lower back. I feel it a little bit here as well. Let me just grab my measuring tape. So I'm just looking for any more obvious indicators. We try to look for anything outwardly that can be giving us an obvious sign of what could be wrong before we diagnose something more internal. But truthfully, I think this is really just muscle strain.
Okay.
I'm gonna have you lift your arm straight up for me. Tips tall, very good. Essentially, I'm checking to see if the extension changes your muscle tone at all, but it doesn't. You have a very even wingspan, which is good. And this area is curved properly here. So keep your arm like that for me for just a second. I have another kind of ruler here. And this one tests specifically for curvature, so I'm going to just then I'll have you rest your hand just gently here. noticing just some slight swelling, mainly
Yep.
in this area here.
That is exactly like
Yeah.
where I feel like everything
Okay.
right there.
Yeah, there is definitely a little more than I would like to see
Mhm.
there. So I'm going to take my calipers and
Mhm.
see exactly how much of a difference we're looking at here.
I think a couple years ago, I did have like a pretty bad muscle strain.
Did you?
Yeah, like under, that's why I knew like it was like a teres and teres major under your shoulder and stuff. It was like swelled up, and like, but it was real bad. I had like no range of motion in my shoulder. Like,
Oh,
yeah.
okay.
So I try to be careful with my shoulders, but I've been trying some new stuff, and I think maybe that's what it's been.
It's quite possible, especially if you're, like you said, you're trying new things, which typically means you're working muscles that you don't usually.
Yeah.
So it's good that you're aware. So we definitely don't want you injuring yourself to the point where you don't notice and then you continue to strain it. Yeah. Okay. So just about a 1/4 inch of swelling in this area, which isn't significant, but it's not present as well. So we'll definitely take note of that. Is it all right if I just leave my tools here? All right, so let's move on here. So this is a tool used for acupressure, and it's for point therapy. So I'll give you just a little bit of an example. If I just apply some pressure here, it targets very specific areas.
Okay.
So I'm going to use this to try to release a little bit of that tension, okay?
Yep.
So I'll start kind of at your clavicle. This might be a little bit uncomfortable, but it shouldn't be painful.
Okay.
It's kind of like micro adjusting. It gets
Yep.
deep into these little crevices, and I can kind of adjust
Mm-hmm.
how firmly I want it. Just let me know if it's painful. So the tension loosens up here, so we're a little tighter here. Okay, so now I'm going to come down. This kind of helps me gauge where exactly we need to pinpoint our therapies. A little bit of tension here. Okay. Okay, Anthony, so I'm going to have you just kind of extend your arm, and I want you to relax it on this wall. So just rest your weight here while I look at this area. So going in between these two muscles. Not feeling too much tension there. So this is the affected area. Let me know if this is painful. Okay, I do feel should be releasing a little bit of that pressure. So now we're kind of pinpointing some lymphatic drainage.
Mm-hmm.
So we've been holding tension in this area. You have several lymph nodes here, and the more pressure you have in your body, the more inflamed they get, and sometimes are unable to release. So this is kind of a toxin release. It encourages your lymph nodes to drain and releases some of that pressure, which is why you're getting that hot sensation here.
Yeah.
So picture like your sinus cavity. If you've been
Yes.
sick, you get that tension buildup and it's unable to release because it's so swollen. similar to what's going on
Okay.
here. So hopefully this will give you a little bit of relief. What I'm actually going to do while I have a closer look at your abdomen is I'm going to start with some cupping therapy. So I have these cups here, and these are just going to be placed on the skin. It will do with light suction. It shouldn't hurt, but you will feel some pressure, okay? So I'm going to place this right in that affected area. Feel okay?
Yep.
I'll leave that on for just a minute or two while I have a look at your abdomen.
Okay.
Abdominal wall is very healthy. I'm not seeing any signs of atrophy. It looks like your core is strong, which I'm sure you know is the foundation of any workout. You have to have a strong core, especially if you're lifting weights, because it truly is what's giving you the power to lift properly. And you can really hurt yourself if you're not protecting your core. So it's a very good sign. I see a lot of my patients who come in and they work out really well, they lift weights, they do legs, they do arms, they work out their back, but their core is very weak, and it ends up actually causing a lot of back problems.
That's what I've really been focusing on more than anything. Trying some new stuff. I was like, I want a really strong core. I think it's like I said, it's the foundation. So
It is very important. And you're able to feel everything normally, right? No loss of sensation.
yeah, everything feels fine. Yeah.
So you can feel all of this equally.
Yep.
Probably a little bit ticklish, but no loss of sensation in the umbilicus area.
Nope.
Perfect. I'm going to have you close your eyes for me. I'm going to do a quick test of your abdominal reflexes. You don't have to say anything. This is just testing for the natural muscles you have in your abdomen. They should respond accordingly. I apologize, I know that's ticklish,
That's
but
fine.
you're doing great. So I'm going to move side to side here. Very responsive.
I'm like, I think it's working.
Perfect, okay. So no abnormality there. And it's been a couple minutes, so I will go ahead and release our cupping mechanism here, and you let me know how that feels on release.
It's good.
Feels okay?
Yeah.
It's going to be a little warm to the touch because essentially we just broke all your capillaries. So you might have a small, looks kind of like a circular hickey or a bruise. That's normal and it will go away. Might be a little sore, just like any other bruise. It's going to hurt just a little bit. So what I'm going to do is some isolated cold therapy. So because the area is warm, this is going to feel very cold, okay?
It actually feels like really good.
It's going to help reduce some of that immediate inflammation. Again, it's helping to encourage that drainage. Good. Okay. So the last thing I'm going to do for this area is a little bit of tapping in the direction that we want the lymph nodes to empty. So we're going to move down and back and up and out. Okay. All right, very good, Anthony. Well, I want to have a look at your back, see what's going on with the other side, the back of your shoulders, and your back overall. So I will have you turn over, okay? Perfect. All right, Anthony, so taking a closer look at your back, going to just have an overall look of the area to start with. fine. No notable signs of swelling or edema. Skin is intact and very healthy. You appear well hydrated. You do have goosebumps. Are you cold?
No, I think
Okay.
it's just like a sensation like a gloves.
Okay.
So,
I'm sorry.
no, it's fine.
Just having a look at the overall muscle tone. So you're gonna feel my ruler against your skin, and again, I'm just assessing for symmetry.
Okay.
Good. Very good. So even with the overcompensation of the right side, you are very symmetrical.
Nice.
So there's no signs that you're working one side significantly more than the other.
Great.
So I'm gonna have a listen with my stethoscope, and at this point I'm just listening for any signs of abnormal blood flow to any of the areas. It's gonna feel a little cold. Very good. Okay. So blood flow is even throughout. So what I'm going to do now is just test some of your skin integrity. So you're going to feel me placing what might feel like a rubber band on your back. It's actually a tourniquet. And I'm just testing for your skin's reaction to it, essentially. Okay. So no abnormalities there. Okay, so let's go into some more targeted palpations. Just want to tap around and percuss these areas. Make sure there's nothing abnormal. Any of that painful?
No.
Perfect. Okay. Very good. Okay. Well, the good news is I am not seeing any abnormalities on your back other than some tension in some areas, which is to be expected given how frequently you lift weights. So if it's all right with you, I will go ahead and do a cupping session on you. I would like to target some more of these more active areas where I can see that your muscles are just slightly overworked, and it'll help kind of release some of that tension after a few days when the swelling goes down, okay?
Yeah, works for me.
Perfect, okay. So let me just get this ready. Start with, so for now I'm just placing these on your back for easy access. I'm gonna start with, look at this area. How is that tension? Is that okay?
Yeah.
Does that feel okay so far, Anthony?
Yep. Feels good.
Go right in this space where I can definitely tell your muscles have been slightly overworked. Very good, okay. So we have a couple more. You ever feel any tension in your lower back?
Yeah, I actually do. That's what really inspired me to kind of get my core together because I felt like my lower back wasn't as strong as it could be.
Do a couple smaller ones here.
Okay.
Okay. So we have all of these placed, and I'm just gonna maneuver them a little bit. Does everything feel okay? Anything too tight?
No, everything was fine.
Okay. So these do need to sit on for a little while, and while they do that, I'll work on some other therapies on your back, okay?
Mm-hmm.
Okay, so I have a little tool here that will provide some vibration stimulation. And I'm just going to be applying this in different areas along your back. Might tickle just a little bit, okay? Just cold to the touch.
Mm-hmm.
Just a little bit of tension in this area.
Mm-hmm.
Not so much on this side, so again we're seeing a little bit of that overcompensation on this side. Just directing some of that inflammation away from the spine. Perfect. Now, I'm going to go and check for some reactivity. So you don't have to do anything, just checking for some normal reactivity, just like we did on your abdomen. So you'll feel various objects tracing along your back. A little bit of overreaction on this side.
Mm-hmm.
Slightly on this side, but I would say more here. Any difference in feeling here versus here?
No, I think my tickle more on that side. That's about it though.
Just tickles a little more here.
Yeah.
Okay. Definitely a little more sensitive on this side, which is okay.
Mm.
It's just a little different. Healthy spinal indications. Very good. So I'm wondering if that kind of overreaction you're having here is because your left side is far more sensitive, which would explain the overcompensation of the right side. So think about when you're lifting weights, the object is very heavy, so you're using your right side to lift more of the strength because your left side is just a little bit weaker.
Yeah.
So you have even an oversensitivity here versus this side. Even with me touching you without a tool, you are far more sensitive on your left side. So I would definitely encourage during your workouts to try to do some left side isolated workouts.
Okay.
So you obviously still want to be working out both sides because you don't want to be, you know, asymmetrical or have one side that's stronger than the other. But right now your body is naturally stronger on the right side. So I would isolate some workouts. It doesn't have to be an entire day, 5 or 10 minutes even while you're at home. Do some stretching bilaterally, but focus on the left side, do some strength training on the left side, and let's start to build up some of the muscles on this side of your body, okay? Because I'm definitely seeing that mainly in this area, which explains why you have the soreness here on your right side, because these muscles are what control this reaction.
Okay.
So that makes a lot of sense to me. So what I'm going to do now is just some skin integrity testing. You're going to feel some light pinches. You don't have to do anything. I'm just checking for skin turgor and hydration levels. You appear very well hydrated. Do you drink water
Yes,
frequently?
got to, definitely.
Very important, especially as someone who works out heavily.
Yeah.
And aside from drinking water, obviously make sure you're nourishing yourself properly. So you're going to feel a cold object. And this is just another test for sensitivity. I apologize, I know it's quite ticklish. Just for a really sensitive left side here.
It's so funny that night and day.
So we can also start discussing what's called exposure therapy, which would be something that you would need to come back in for. We could schedule you an appointment, and essentially we would be overexposing the area to stimuli to try to decrease that sensitivity. So I know it seems sort of counterproductive. Why would you want to overstimulate the area? But think about kind of an abrasive pad. Over time it's very abrasive, but it gets worn down, worn down, worn down the more that you use it. So we would essentially be applying different stimulus to this area, whether it be cold or vibration or like a soft touch object or my pinwheel or even just some slight percussions to the area to kind of overstimulate and desensitize these nerves here, okay? So that's something that we could always discuss. So it is about time for me to go ahead and release these cups. So I will do so slowly, hopefully in a manner that won't cause any discomfort. So I'm going to start with these smaller ones, and you will feel just a release of pressure. Good. Very good. Like I said, swelling and discoloration is expected. Very good reaction in this area. Here as well, you are carrying a lot of tension. Just set these aside, and then I will kind of assess our progress. Are you feeling any kind of tension release in those areas? You should be feeling some heat release for sure.
I definitely am feeling the heat release for sure.
So I'm gonna grab my Penlight and have a look. Okay. So we got a very good reaction today. I see the areas that were more notably tense, especially here. Got a very strong reaction in this kind of mid-back area. As well, I would say the right side was slightly more reactive than the left, which is kind of what we expected. So we definitely got much stronger reactions here than we did here. Again, connected to that injury area. So that's very good. That shows me that there is some tension release here, and hopefully you should be feeling some relief in the next coming days when this swelling goes down. So what I'm going to do now, just before I send you off, is some very slight gua sha. So essentially gua sha is the act of promoting healing in certain areas of the body. So I have a tool here that is smooth, has rounded edges, and it will allow me to just kind of recirculate the tension in some of these areas, okay? So you're gonna feel some tugging, maybe some slight pulling. It will be very brief, and it's just to help further release the tension in these areas. Just moving over to this right side and relieving some of that excess tension in this area. Alright, Anthony, so not much of this gua sha is needed. We did relieve quite a bit of tension here. Like I said, I would recommend doing those isolated workouts. I also have a stretching guide that I will give you on your way out. Highly recommend doing that. We want to continue to strengthen our muscles aside from kind of building those weightlifting tolerances. So I would like to see you back in for another cupping therapy in a few weeks. And if we kind of cycle through therapies, we can find something that works for you. Sometimes it's a rotation of therapies, and we can get you back on track to feeling back at your best, okay?
Yeah, definitely.
Perfect. Well, I will go ahead and hand you your shirt. You can get dressed, and then I will give you that stretching pamphlet, okay?
Thank you.
Thank you so much.
Yeah.